It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
And welcome to UofL Today with Mark Hebert on 93.9 The Ville. As most of you know who have heard this show before, it's a half hour of good stuff about the University of Louisville and the good things going on at UofL. So on the show today, you've probably had a loved one with pneumonia in the past couple of years, perhaps. 1.5 million Americans are hospitalized with community-acquired pneumonia, and a third of them will die within a year. That's a stunning statistic. A U of L researcher's done a lot of work on that data and possible prevention of these dangerous infections. He'll be here to talk about it. But first, students can be disruptive in class for any number of reasons, as most teachers know, one of which is they're struggling to read because of vision problems. Daniela Turson de Pelville is an assistant professor in the College of Education and Human Development, while Nate Cleary is an undergrad at U of L who helped work on this research. So welcome to both of you.
Thank you.
And I'm going to try, Daniela, not to torture your name several times during the next few minutes, okay? But welcome. You're from Argentina, right?
Argentina.
How long have you been at U of L?
Since I came to do my English training in 2001, so
You've been here a while. 16 years. Okay, 16
now I'm
years.
at faculty.
Got it. Nate, where are you from?
I'm from E-Town, so about 45 minutes away.
Yeah.
I went to EKU for my first semester, and then
Well,
I
that was a
transferred over
mistake.
here. Oh, yeah, it was pretty bad there.
No,
Culture shock.
that was supposed to be a joke. Nate.
I know.
That was a
And then I
joke.
came here, and I loved it. So I played rugby here for the University of Louisville for
Okay.
3 years.
On the
yeah,
club
so-
team?
Yeah.
Okay, and now you're a grad student, right?
And I'm
Undergrad.
undergrad still.
Are you still
but-
undergrad?
Yeah, still undergrad going into my grad student,
Gotcha.
hopefully.
Gotcha. All right. Well, let's talk a little bit. There's really probably three things that we need to talk about here. Vision and its link to learning and behavior, the study you've done that's kind of tied in with the Minds in Motion project you've got going on with an elementary school here in town, and also Nate's experience as an undergrad doing research. We want to talk about all those three things. We'll try and jam them in here in the next 12 minutes or so. All right. Well, let's talk a little bit about this study linking vision and behavior and learning in the classroom. Daniela, why don't you tell us a little bit about it?
Okay, so basically the main idea started with Minds in Motion. Minds in Motion is a program of physical activity that was developed by a reading specialist. Her name is Candice Mayer, and she's amazing. And she noticed that kids struggle with reading, but those kids were also the kids that were more clumsy, less coordinated, less physically active. And so she started doing some interventions that is physical activity and eye exercising that are supposed to help kids at the school. And so I've been intrigued with this since 2012. In 2012, we did the first pilot study here at U of L with preschoolers at the Early Learning Campus.
Which is on U of L's campus.
U of L, yeah, the daycare, and the kids that participated show. So basically, we have two groups. They have free playtime versus Minds in Motion, which is a structure, and they all did better in behavior and coordination, balance, and all of the things. So from that, we have been growing, and we have one school now doing Minds in Motion, and that is the part that Nathan was working last year. Which is Hawthorne Elementary. We chose Hawthorne because the principal is awesome and she wants to do it.
Okay.
And second, because it's the only Spanish immersion school in Kentucky with a large number of minority students. And minority students usually are the ones that receive less physical activity in general. So, and for many people, it's hard to go exercise after school for logistics, for economic reasons or whatever. So we did last year, what we did was two groups. We compare power yoga versus Minds in Motion. Minds in Motion, basically, just to give you an idea, is like a circuit with different activities, mini trampoline, rotation, balance.
So some gymnastics, sort of
fun.
gymnastics,
So,
mini gymnastics class. Okay.
Yeah.
And so that's what you've got going on at Hawthorne Elementary School.
Yeah, and we did
all right?
that last semester, and this semester everybody at Hawthorne is doing
Okay.
this project. Every kids receive 15 minutes of physical activity every day.
Okay. And so the study you did with the preschool kids
Yes.
at U of L, and now you've got this going on at
Yeah.
Hawthorne where there are very specific gymnastic type activities.
Yes.
What's the difference it's making? And maybe Nate can talk about
Yeah.
this. what's the difference it's making in their ability to learn, pay attention, and not be disruptive in the classroom?
Well, for now, we are at the beginning. We are still analyzing
Of the whole study
data.
at Hawthorne, right?
But I can tell you what's going on in one school in Indianapolis that we are also doing the study. It's a middle school. These are kids in the reading remediation program. And they have an awesome teacher. His name is Matt Martin. And he started incorporating Minds in Motion in 6th graders that are in this remediation program. And the improvement in reading was so significant that basically we are joining together now. So we are measuring those kids, and we have 2 groups, kids with regular instruction and kids with Minds in Motion. And kids with Minds in Motion are increasing significantly. So with elementary school, we are still in the process. We have to analyze the data. What Nathan did, you want to talk about it?
So
All right,
basically,
again, this is Nathan Cleary, who's an
Yeah.
undergrad at the University of Louisville, who's been doing some research with Daniela. But
Yeah.
go ahead,
yeah.
Nathan.
So what basically we did, we had a station where they used the visual efficiency. So they would have like a string, and then they would focus on each bead that we put on the string, and they would focus. They would do eye movements. So the visual efficiency is not like the actual vision of the child. It's how they use their vision, how their eyes team together to perform different tasks. We actually did a test called the VER test, and a lot of OTs will use it.
What's an OT?
Occupational therapy.
Okay.
So a lot of OTs will use it for telling like how well that these children or people can use their eyes. And we actually found that with the VER testing and hyperactivity and attention, those scores were actually correlated negatively. So if they had a low score in VER, it means that they had a higher chance for symptoms of hyperactivity and inattention. So these children that aren't focusing, using that don't have
They
this,
find it tough to focus.
they have tougher time focusing in class, and their hyperactivity, they're all over the place. Their eyes can't focus on one point. They get bored, and then they move around. So that's where the inattention and the hyperactivity comes into play.
And the purpose of this is what? What are you trying to show? That kids need this sort of physical activity
Right.
during the
Yeah.
classroom day or
Basically,
the class day?
in America, it's hard because people aren't active enough, and it's hard to get people to become active enough. And these children aren't going out and doing these activities, and you basically train the body to adapt to the environment. And with school, it's hard because if they're not moving around, they're not doing anything, they're not training the body. It's
Yeah.
Right.
not.
But Daniela, I think the
Yeah.
difference is, I think you pointed it out earlier, we had recess when we were in school. We just
Yes.
ran around the playground, climbed, did the
Yes.
jungle gym, whatever, and did the swings. But what you're talking about here is very
Yeah.
constructive, that works on their agility skills,
Yes.
basically. And that could make a difference as opposed to just going and running around the playground, right?
Yes.
Yep.
Okay.
Yeah, basically my goal, hopefully my
Depending on what the study shows, right?
is basically advocate for more quality physical activity for everybody, especially younger kids, because if we want to build the person not only intellectually but also as a full package, you need to incorporate more physical activity. We are made to run, to climb. We are animals, and it's in our genes, and we are losing that for technology. And so instead of spending that much time in instruction, sometimes more time doesn't help because kids need that break. And
Right.
research has shown that more physical activity is linked with higher quality and academic achievement and performance and concentration and quality of life.
So what would you tell those teachers and those school principals who say, look, I've got X number of 6 hours in a day, and I've got to teach them math, English, social studies, etc. I've got to get all these things that I'm going to be tested on, these kids are going to be tested on at the end of the year. I don't have time for them to be running around for half an hour, jumping on trampolines and doing things with string with Nathan over here. I just don't have time to fit that in my day, so I just can't do it. What would you tell them?
Okay, so I will tell them that we are doing that at Hawthorne. They are only doing 15 minutes, but every day. And that is the time that usually they use for lining, to wait for the bathroom or have a water break. So if you are strategic, you can incorporate some breaks during the day. It doesn't have to be like 30 minutes of activity all at once. It can be in breaks of 5 minutes, or you can do what we are doing at Hawthorne, we are still trying to figure out how this is doable for the teachers.
How to fit it in today.
That is the part of what we are doing now.
All right, Nathan, you got an experience that a lot of college students don't get.
Yes.
You got to do research as an undergrad. So talk about that a little bit.
Oh my gosh. So I first got into it out of just random likingness of wanting to do research, and I wanted to have my resume a little bit built for the grad school. So I kind of emailed a couple of my professors like, hey, how do I get into research? And they're like, well, I don't do research here. Here's a couple of other faculty that do research. And I got in contact with Daniela. And the first meeting, I remember, she was like, yeah, so here's my research. This is what we do, blah, blah, blah. And she's like, we actually have a meeting in like 5 minutes. Do you want to come? so I was like, sure, why not? So I went in, and it was the whole team that was doing the research there. And I was just out of the blue, just, okay, I don't know what's going on, what's happening. And then she kind of explained it. And she would always come back, and she was like, I know, Nate, that you don't know anything what's going on here, but we'll get you back into it. And so she was kind of like pushing me to the research and saying like, this is awesome. This is what you would love. And so I got the whole detail of what was going on in the research, and I was just like fascinated about it because it was very factual and it was very relative to today.
So what do you want to do? You're in the College of Education, but what do you want to do?
I want to do occupational therapy.
Okay.
I have my eyes set on a lot of spinal cord injury patients. I've been doing an internship at Fraser here in Louisville, and lovely, lovely people. Erica, she is one of my other mentors. It's really good.
Yeah. So what has it meant to you, though, as a student, as an undergrad, to be able to do undergrad research, which is, University of Louisville is a research institution that makes that available to undergrads. What's it meant to you in terms of what you've been able to learn and prepare yourself for your, hopefully, upcoming career?
It's honestly a very prestigious honor and kind of experience to do. A lot of these other colleges don't really have that experience for their students. They don't allow them to do research unless you're on a higher level. So being an undergrad and working with these graduate students, it makes you kind of think out of the box, and it kind of prepares you for the harder courses, the PhD level courses for the other levels of college. And so to have that and under my belt is just an amazing experience, and it kind of helps you just broaden your senses of learning.
All right. And Daniela, let's wrap this up. So what's next with your research and your study on these kids at Hawthorne Elementary, and how exercise helps them?
So ideally, well, we are in the process of analyzing the data from comparing the two groups. Now we are also in the middle of incorporation in the whole school. My goal is that they continue to do minds and emotions after I'm gone, and it looks like a very likely possibility.
Okay.
And my goal is just finish data analysis, start publishing, and hopefully advocate for more quality physical activity when I have data to show why it's important.
And if it works, other schools should do it too.
Everybody.
You're gonna pitch them on the idea to do it, right?
Yeah.
Okay. All right. Very good. Daniela Turson de Pelville and Nathan Cleary, thanks for being on the show. Appreciate it.
Thank you.
All right, and good luck to you, Nathan,
Thank you
as you
so
go to graduate
much.
school. All right. 1.5 million Americans are hospitalized each year with what's known as CAP, community-acquired pneumonia. You may have been one of them or were lucky enough to survive. Well, UofL's chief of infectious diseases, Dr. Julio Ramirez, has been studying the growing danger of CAP, and he is here to talk about it. Dr. Ramirez, welcome. Good to see you.
Thank you. Thank you for the invitation.
All right. What is CAP? Why don't you describe what community-acquired pneumonia is? Then we'll get a little bit into your studies.
Yes. As a general concept, pneumonia is an infection of the lungs, and then we characterize based on the location where you develop the infection. You develop the infection in the hospital. We call it hospital-acquired pneumonia.
Is that HAC or
Exactly.
HAP? HAP, yeah,
HAP.
okay.
You develop the infection in the community at home is called community-acquired pneumonia, CAP.
Okay.
And from the medical perspective, we have this distinction because the bacteria that tend to cause pneumonia are different. You're in the hospital versus the community.
Okay. And pneumonia is what? What does it cause? What happens if I get pneumonia? What happens?
Well, until recently, we considered that pneumonia was an acute infection. Bacteria, we usually have bacteria, let's say, in the mouth, in the oropharynx, and on and off, a little bit of saliva gets into our lungs. Seems to be that this phenomenon is very common. Sometimes when we sleep, we snore, then bacteria get into the lung. But the lung has defense mechanisms that kill the bacteria that arrive there. But on and off, if something is wrong with your defenses, or a lot of bacteria arrive, bacteria multiplies in the lung and give you pneumonia. When you go to see a doctor, the doctor give you antibiotics. Most of the time, you get better. And if the pneumonia is serious enough, you may need to be hospitalized for intravenous antibiotics. At this point, we know that you are hospitalized, the risk of death is around 6 to 10%.
Okay, so if I get hospitalized, there's, what did I say, 1.5 million people are hospitalized with community-acquired pneumonia. Yeah. So how many of those folks, out of the 1.5 million, you had, what's 6% of 1.5 million, whatever that is, whatever that number is, that's how many people died, right?
Well, yes, the interesting thing is that the research that in part we are doing recently is that if you have, in the past we say, well, you are admitted to the hospital, you are discharged from the hospital, you survived pneumonia, we thought that this was the end of the story. But now we are learning that if you have an episode of pneumonia, there's a good possibility that even if you survive the hospitalization, that pneumonia affect your system, your body, and then you may have heart disease, coronary disease, kidney disease, liver disease, and the pneumonia accelerate your other diseases. And then we notice that there is high mortality even at 1 month, 6 months, and 1 year.
Okay.
And this is what we just identified in our study, is that for all hospitalized patients with pneumonia, at 1 year, 1/3 of the patients are going to be, 33% are going to be dead in 1 year. Then we are now...
Wait a minute, let's back up here for a second.
Yes.
Again, we're talking with Dr. Julio Ramirez from the University of Louisville. We're talking about CAP, community-acquired pneumonia. So of the people who get community-acquired pneumonia, that 1.5 million folks that were hospitalized, within a year, 500,000 of them are going to be dead. Is that what you're telling me?
Yes.
That's a lot of folks.
This is...
Do you think people realize how bad a problem this is?
This is a problem that no, people don't recognize, because these are new studies that we tend to follow the patients for a long time. Now, I don't want to put things into perspective. If you are hospitalized for whatever reason, well, chances are that in 1 year, some part of the population is going to die. But what we notice is that the population, this may be 10, 20%, but not as high as the patients that have pneumonia. Then what we are, again, the point here is that you have diabetes, and you are 70 years old, you have diabetes, congestive heart failure, and in your life expectancy may be another 10 years. Mm-hmm. But if you develop pneumonia, your life expectancy is going to decrease significantly. Then what we are trying to bring the point here is pneumonia is not just an acute problem, that if I survive pneumonia in 2 weeks, I go back to normal. No, you don't go back to normal. You go back to a different level, because pneumonia has produced something in your system. Then again, with the idea that it's critically important, it's always important to prevent pneumonia, but now it's even more critically important because of the long-term consequences of pneumonia.
And just to be clear, and when you were talking about its impact on other health problems that you may have, it exacerbates the infection you get from pneumonia, even though it appears to be gone in 2 or 3 weeks. It exacerbates something else you might have, some other health problem, correct?
Exactly.
Is there any particular health problems that it really exacerbates, makes, kidney problems or, asthma or something like that? Or has the study not gone that far?
We are definitely, this is our areas of future research. We are very interested in understanding how is that pneumonia affect, and why is that you have a decreased life expectancy after an episode of pneumonia. The hypothesis that we have, the idea that we are working, is that most of the comorbidities, if you have asthma or chronic obstructive pulmonary disease or heart disease, it seems to be that it's a common theme that is chronic inflammation. We live in a state of chronic inflammation. Then you have an inflammatory process that is going on. And probably pneumonia, being an infectious disease with high level of inflammation, probably your chronic inflammation get accelerated. And this probably is we think that this is the connection of pneumonia with diabetes and pneumonia with coronary artery disease. Because we know, for instance, atherosclerosis, number one cause of death and heart disease. Atherosclerosis by itself is an inflammatory process. It's an inflammation in your plaque, in your arteries. Then having an acute inflammation for pneumonia may accelerate another inflammatory process that you have. This is the hypothesis that are going to be working now.
And the potential danger for folks that get pneumonia, obviously, the potential big danger. Now, you work in Louisville hospitals, right? You work for UofL, but you work. Do you work in several different Louisville hospitals with the pneumonia patients?
Yes.
Okay. And you did a study that was based on a number of patients you looked at in Louisville. Why don't you tell us about, what role did your Louisville patients and folks in Louisville play in that study, and what did you find in this study?
Yeah, the study is going to be published next month in the Journal of Clinical Infectious Diseases, and that is the primary journal in our specialty in infectious diseases. And the title of the study really is Incidence, Epidemiology, and Outcomes of Community-Acquired Pneumonia in the United States. But the reality is that we study all the patients in Louisville. This was a population-based study. And just for the audience, population-based study is when you look at all the patients in a particular area and you study the full population. Only one study in the 70s was done, because these studies are very difficult to do because, for instance, in the city of Louisville, we have adults, 580,000 adults, according to the census of the city of Louisville. We wanted to see how many of these adults develop pneumonia. We needed to work with every hospital in the city of Louisville.
So it's tough to pull all that information together.
Yes. To be sure that you are hospitalized with pneumonia, we are going to capture your information. Then over the years, we've been collaborating with all the hospitals in Louisville. Initially, we were funded by the Center for Disease Control to do a study of influenza and the role of Tamiflu on influenza. Then we started developing a network working with all the hospitals, and then we decided to do this study. That is a study essentially counting how many patients get hospitalized and to see what happened with the patient. What is your outcome? In this regard, there are 9 adult hospitals in Louisville, and for 2 consecutive years, every day, we followed all the hospitalized patients. There are approximately 90,000 hospitalizations a year.
For pneumonia in Louisville?
No. Excuse me. 90,000 hospitalizations, yes, a year in the city of Louisville.
And how many of those were
And
pneumonia?
from this, we were able to, it's an average of 3,700 patients with pneumonia every year. Just to look at the scope of the study, we were essentially evaluating 90,000 patients a year to identify.
Right, to pare it down to the
yes.
3,700 who had pneumonia.
Exactly. And then to follow this patient for 1 month,
And
6
up to
months,
1
1
year.
year. And then essentially, and then in 2 years, we review these 180,000. We have the number of patients, 3,700. Then you say, well, there are 580,000 adults in Louisville. Then you can make the number per 100,000.
Right.
And we have 649
You extrapolate that
hospitals
out.
per
Right?
100,000. Then you move to the United States.
Well, let me ask you this. Out of the 3,700, now based on this study, that's where you came up with the numbers about how many would die within a year if they were hospitalized. So do you have that number for 2 years? Does it get any worse after 2 years, or do you know?
We have not had the number of 2 years yet.
You're not the 2
even
years
though
yet.
as
Okay.
the study at the time progress, we are going to keep looking at the numbers.
Okay, gotcha. All right. Again, we're talking to Dr. Julio Ramirez. He is the Chief of Infectious Diseases at the University of Louisville and in the Department of Medicine. You also have won, the reason we're talking with you about this, not only do you practice at UofL and you're a professor at UofL, but also you are an award winner. You got a big award in 2013, some presidential award, right? Why don't you tell us about that?
The European Respiratory Society has a presidential award that is for one person that they consider in the area of respiratory disease has contributed, and I was received the award at that year for our contributions to the area of pneumonia. We've been working on pneumonia for more than 25 years. I started at the University of Louisville as a faculty in 1987, 89. And during the 90s, our research in pneumonia was the idea of seeing if the patient was improving in the hospital, the idea that we may not need to use intravenous antibiotics for a long period of time. We can go from IV to oral, what we call switch therapy. Of course, you have to put into perspective that you were with pneumonia in the 90s, admitted to any hospital. You were staying in the hospital for 10 to 14 days, giving you IV antibiotics for the full duration of time.
Right.
The standard of practice now is you get into the hospital, you get better, you go immediately to an oral antibiotic and go home. And we were probably the first group looking at this mechanism of treating patients.
So the treatment has changed for pneumonia over the years.
Yes.
Right? So what's for the future? What are the guidelines that doctors should be following and patients should be following now in terms of figuring out, A, do I have pneumonia, and then B, how do I treat it? Community-acquired pneumonia.
Yes. I may say that as with anything, as you know, in medicine, the first thing will be prevention, and what we have for prevention of pneumonia, the primary elements is first of all, we need to every patient needs to stop smoking, because when you smoke, the cigarette smoking, not only we have the long consequences of cancer that is we are aware, but when you smoke, your defense mechanisms are weakening in the lung. Then if bacteria arrive, you are less protected to fight the bacteria.
Right.
And smoking is a risk factor. As we discussed also for everything, another thing that decreases our defenses is if we drink alcohol in excess.
Mm-hmm.
Then,
so quit smoking, go easy on the alcohol.
Exactly. And then vaccinations.
Okay.
There are vaccines to prevent influenza, vaccines to prevent streptococcus pneumonia is the primary bacteria. Then there are a couple of vaccinations that are indicated to prevent pneumonia.
We only got about a minute left here, but is there a problem with people who get something in their lungs, they think, oh, it's just a bad cold, it's a chest cold, and they don't take care of it immediately? Can that hurt their chances to recover from pneumonia?
Yes.
If they don't go to the doctor immediately.
As in any infectious diseases, the answer is that most of the time, I may say there's a virus in the community, most of the time it's not going to be pneumonia. But if this is pneumonia and you spend 1, 2, 3 days before you go and see a doctor, you have pneumococcus is a very common bacteria. In pneumococcus, the bacteria multiply every 15 to 20 minutes. Then every day that you don't get antibiotics, imagine the number of bacteria, extra bacteria that are in your lung. Then you reach a point that even then with the appropriate antibiotics, it's going to be too late.
Right.
Then early medical attention is critical, just to see if you are the person that have this chest pain, this fever, these chills are due to pneumonia or not.
So get to a doctor quick, quit smoking, go easy on the alcohol, and pay attention.
And get the vaccines.
And get the vaccines. Sorry about the vaccines. All right.
Yes.
Dr. Julio Ramirez, good talking to you.
Thank you.
Good to have you on the show. Appreciate the work you do. Thanks for listening to UofL Today with Mark Hebert. Go Cards!